Good morning, friends. Thank you for stopping by from wherever you're watching from. Good morning, good afternoon, and good evening. So remember, making your health a priority. So the topic today is diabetes, and I'm going to be using layman terms. I'll use terms that everybody will understand. Okay. So now, what is diabetes? Diabetes is a long-term condition. When I mean long term, I mean chronic condition that actually affects how your body turns the food you eat into energy. And it's related to insulin, like a hormone insulin. And now, what does this do? It actually helps the sugar. When I mean sugar, I'm talking about glucose, to enter into our cells, and then they use it as fuel. Now think about you having a car. If you don't have fuel, what happens? Your car actually breaks down. Your car stops you somewhere, right? That's how this insulin works. So now, there are different types of diabetes. We have type 1, we have type 2, we have gestational. When I mean gestational is during pregnancy. Okay, so for this type 1, this is when your body doesn't even make insulin at all, and it's diagnosed in children. Yeah, this is mainly for children and then young adults. Okay, so in this case, you need insulin injection. You need insulin, right? So remember what I said about the insulin. It's kind of a sugar. It's going to enter into your cell, and now it's going to be used as fuel to help you move your car, right? To help you move your body, right? So now type 2. What is this type 2? Type 2 is you have it. You have this insulin in your body, right? But your body is not just making good use of it. We call it insulin resistance, okay? What happens in this process? It's just that this is mainly common, and then it's actually linked to lifestyle, how well we live our life. Lifestyle changes, yes. How do you eat? What do you eat? How do you exercise? How about your weight? Are you doing trying to control your weight? What are you doing? For yourself. Remember, making your health a priority. So in this case, we can manage this with lifestyle changes, okay? With lifestyle changes, and also medication as well. Yes, we can take medication for this, or we can get insulin too. Yes. I won't be talking about the medications, I won't be talking about that online. Yes. And then talking about the gestational diabetes. This is when you have diabetes during pregnancy. This can actually lead to the death of your baby and you as well. Yes, it can. Some people, when they're pregnant, they don't like to go for antenatal. It's very important, it's very important to go, because you don't know what can happen. Remember, your body changes like almost every day when you're pregnant. So I recommend you always go and check your body out. Yes. So when they check your blood sugar when you're pregnant, it depends, okay? Because there's a way it's been done. Yes. So just make sure you go check yourself out. Okay. Now there are a lot of things that can cause this diabetes, like the symptoms. Let's talk about extreme hunger. It can be tasty, a lot of like too much tasty, too much um, being hungry, peeing a lot, frequent urination. Sometimes when you are urinating a lot, you will be thinking, oh, it might be infection. Yes, it might be infection. It might also be related to diabetes. Okay, that's why you always need to make your health a priority. That's why you always need to check your blood sugar. You can go into a clinic. Sometimes you feel dizzy. You feel different from your body. You always go check yourself out. For example, in the hospital, if something happens, maybe for instance, they call a cold. What I mean by a cold is maybe someone is about to die. So what happens? That is the first thing we do, to check the blood sugar, because it can be too low, it can be too high, and it breaks you down so quickly, like so quickly. You go down so quickly. Okay, so let's remember that point. Is very, very important. Okay, and now what are the complications? Diabetes can affect your heart. Yes, diabetes can make your heart to stop working. It can. It can also damage your kidney. Diabetes can damage your kidney. It can damage your nerves. Okay, it can actually damage your nerves. And then your eyes. How about your eyes? Have you wondered why some people just go blind? We call this retinopathy. This can damage your eyes. Okay, so remember, that's why at old age they always tell you have to go check your eyes. But meanwhile, do we really have to wait for old age to come before we can go check our eyes out? No, we don't. Okay, and then foot problem. Oh my goodness, this one is general. Okay, for example, in our African place, when something happens and it doesn't heal, you term it like, oh, someone did this to me. No, it's not always that somebody did that to you. Maybe you have diabetes and your wound is not healing properly, and you won't even wonder to go to the clinic to check it out. Yes, diabetes can make your wound not to heal. It can cause your foot. It can cause you your foot. It can make them cut your foot out. Yes, diabetes is deadly if it's not properly controlled. Okay, then what else? How often do you drink water? How often do you feel different in your body? Sometimes you feel cloudiness. Sometimes you feel like passing out. Sometimes you feel so fatigued. I bet you the first thing you should do is to check your blood sugar. It doesn't take anything. You can even buy the machine at home and keep. It's just a small machine. Yes, it doesn't occupy any space. You can do this all the time. Remember, at home we like to eat all this swallow, fufu, different kind of stuff. So it's best for us to always check our blood sugar out, and not to always turn our illness to something different. Always remember making your health a priority. Thank you. If you have any question, do me well to drop it. I will answer it. Thank you.